very happy to turn things over to you.
Great. Thank you. Hi, everyone. It's nice to see you all. Nice to see some faces that I know and see a lot of new faces. So my name's Danelle. Thank you for letting me hop on today. Happy to talk about all things family all the time. So this is excellent. And if you have questions, I am not formal, so happy to chat about them after. If something comes up and you want to talk about it in the moment, feel free to jump in. So just want to do a little bit of a general overview about how we're thinking about engaging loved ones in care and client care, and then some of the things that we can do, from the very beginning, from the ground up when we're engaging loved ones. So, something I always like people to reflect on is, oftentimes we use the word family, right? And so when I say the word family, what comes to mind? Does anybody have any word or two that comes to mind? Yeah. Got it in your head? Okay. So, oftentimes when we think of the word family, we think, nuclear family, blood relatives. And I think it's important sort of as step one, when you're working with individuals, is to really think about a broader definition of what a family system can look like. So it could be a neighbor, a best friend, a significant other, a spiritual leader. It really can run the gamut. And so sometimes when we use the word family, people get stuck in this cognitive set. And if they don't have a good relationship with their blood relatives or their nuclear family, they have a hard time even thinking about who they might engage. So sometimes the easiest way to go about, starting the conversation about who they might want to involve in their treatment and engage with you or with your team is by asking questions a bit differently. So, who calls you if they're having a really great day? Who calls you if they need something? Who do you call if you're having a rough day, if there was something you need, if you have good news? And I think that oftentimes, individuals, especially those living with mental health diagnoses, they're used to, who do you call when you need something? I think the opposite of that is as important, if not more important, is who calls you. Sorry, I think my connection. Also, who do you not just calls you? Really about their role within their larger family system, however that's defined. That reciprocity of relationships can really build a lot of confidence in individuals. Also, you have somebody something when you're asking those initial questions to set the stage for that individual, that we don't just mean your nuclear family. So why families? Why now? Oftentimes, unfortunately, families can be viewed as problematic. They call often, they monopolize the treatment appointments, or you can never get a hold of them, right? It seems like they fall on a continuum. This is what I hear often, in all my years, 12 years with the Best Center in this role, you hear the words like enabler or toxic or uninvolved or over-involved. And so how do we really get families, loved ones, family systems to fall in that sweet spot of engagement? And much of that is really driven by us as the providers to help guide them along their personal journey and their lived experience, but helping them to figure out their level of engagement, when to step in, when to step out. And really helping us to shift to a more solution-focused discussion about how we engage families and in what way, in a very planful way. Unfortunately, we're really thrilled, in my experience, when somebody has a supportive and knowledgeable loved one that is engaged with the provider or with the treatment team. But honestly, this could and should be the norm. And I don't say should too often, but truly it could and should be the norm. So, family systems can be a help or a hindrance to our work. And much of that is really determined by us. And they need this roadmap. This is often their first endeavor into the mental health system, or they've been on this cycle time and time again, and they need something new to try. And so we really are that roadmap for them. So, involving families, it sounds great, but it actually does work. And so there's been nearly 40 years of research now that, when we involve families, loved ones who are knowledgeable and supportive, so when they've had that support to gain the information and to know how to be appropriately supportive, outcomes are improved, and not just for the individual, not just for the client or the patient, but for the whole family system. So we do see, individuals are more adherent to their treatment plan, including but not limited to medications, which means they're going back to the hospital less often, which means they're, decreasing costs of care on our system, our healthcare system. We see fewer relapses and rehospitalization rates, but we also see improved family well-being, family relationships, family members feeling, family system feeling less burdened. But we also see people getting back to work and engaging in social relationships, and that includes the loved ones as well. And so there's a great, I just wanted to share, there's a great document out there that was first developed in 1994, and it has gone through several iterations. And every time this group, it's called the Schizophrenia Patient Outcomes Research Team. It was a group of individuals who, poured through all of the literature, and they found, what really works for individuals living with schizophrenia. And one of the recommendations back in 1994, and who's made it into every version ever since because we know it works, is to provide family-based services. Ideally, it's in that 6-9 months to 2-year window where you have ongoing constant engagement of these loved ones in a structured family protocol, but that doesn't fit for everyone and for every family system. And so as long as you provide 4 psychoeducational sessions in less than 6 months time, you still see some gains, maybe not as robust, but you still do see some differences and some improvements for individuals. So, what we're talking about, it does work, but that doesn't mean it's always easy to engage family members. And so, thinking about what we can do. And so one is thinking about how we frame our initial questions about who they might want to engage, sometimes avoiding that word family or coming about it the back way by asking questions in a little bit of a different frame, but also thinking systemically. So when we're working with individuals, oftentimes, we're trained and we're able to bill where this is the person that we're focused on. This is the time that we have. We know that engaging with individuals outside of that takes more time away. It's not always productivity time. And so how do we make that work? So, it is really a pivotal ingredient with the work with that individual. Nobody lives in a vacuum. And so you could have the most wonderful session. You worked on some great stuff, you send them home with some skills, and nothing is more frustrating than when all of that kind of falls away or is undone as soon as they get home, because the family is really not informed about what work you're doing and how they can be supportive of that, how they can reinforce that, how they can practice those skills. So it's really important to think about that person within that larger system. And we also know that whatever impacts the person with whom we're working impacts the rest of the people around them, their system, but also whatever is going on in that system impacts our individual. So it's important that we have ongoing connections and communication with those other individuals so that we can really have perspective on what the individual is experiencing when they leave our office. Some of the things to consider our cultural factors, beliefs, values, traditions, religion, spirituality, trauma, life experiences. And I don't just mean for the individual. I truly mean for those people who play significant roles in their lives. I think sometimes we get in a sticky situation if we make a treatment recommendation that seems to be in direct opposition to what a family system believes. So maybe the individual we're working with is open to trying, just say medication, for example, but medications are something that their parents, just as an example, based on their belief system, they're really opposed to that. And so if we don't know that the family is not going to be supportive of that, and we're making recommendations that they feel fly in the face of their values, we really cause a lot of turmoil in our relationship, and it takes some time to rebuild that. So if we have an understanding of what the values and beliefs are, it makes it easier to do these conversations with the individual and those people with whom they live or who play a really important role in their lives as early as possible in your treatment planning. So what can we do? Identifying needs and goals. So what do most of us want? Most loved ones, we want to feel heard, we want to feel understood, we want to receive help, but we also want to be part of the team and we want to be of help, when we're thinking about our role with caring for any of our loved ones. And the only real way to know what exactly this unique family system needs is by asking them and then meeting them where each, there's the adage, meet the client where they're at. It's true for the whole system. We have to meet those the individual and the system where they are. And then it's our job to figure out, okay, so these are the family system's needs and goals and wants and desires. And how does that map on to the individual's goals, wants, and desires, and what the treatment plan is, or to find some common ground where we can meet in the middle, even if we're not on the exact same page. And some of that is really just saying, we have different pathways of getting there, but the good news is we all want the same thing. The individual, the treatment team, and the loved ones all want this individual to be living a happy, healthy, fulfilling life, right? And so you don't agree with medication. We're thinking that he needs medication. How can we find somewhere in the middle to meet? And, that's the start of the conversation. And sometimes just approaching it in that way, that we don't agree on the path to get there, but we have the same end goal, that gives us something to work with. And that will bring some down any kind of defensiveness or some of those walls that you might come up against. So thinking about how you're defining engagement, right? So, when you introduced today's topic, I think it was really important, saying how important engagement is. And that's exactly that is true. Engagement is absolutely critical. But what does that look like for an individual system? And can it look different for different systems? It's not always a cookie cutter way that we have what engagement looks like in our minds, but does this definition that we have fit this family and individual's current needs, capacities, and abilities? What are the roadblocks that are getting in the way to their engagement? Has their level of engagement changed over time? What worked in the past? What didn't? And so, just considerations as you're thinking about, well, I think, this family they're just not engaging. Well, has that changed over time? And if so, let's go back and kind of map out where that change occurred and what might have happened there. And if they're a family that just isn't actively engaged from the very beginning, what are some of those barriers that might be in the way? Are they getting their basic human needs met? If they're worried about making sure the lights are on and the heat is on, it's very difficult for them to be thinking about coming into, for example, a family psychoeducation session. And so we really have to assess what's happening again within that system. Talking about our expectations, really being transparent, this is what as a team or as an individual provider, this is what I'm hoping to do with you as a family system, but does that fit for where you're at right now? And is that the healthiest choice? Sometimes if, we ask a family to say, hey, can you, make sure to bring him to his appointments, make sure she takes her medication. That can really pit loved ones against each other. If there's a level of frustration for the individual that, I'm 23 years old, I don't need you checking on me, mom, to make sure I'm taking my medication, then that may not be the best strategy for this family. And so really being open and having open conversations with the individual in the system about what our hopes and expectations are. And, obviously, is the family aware and is it reasonable? Something else to consider is taking a stepwise approach to engaging loved ones. So, I think about it in sort of 3 or 4 steps, really figuring out the who supports the client. And that's what we were talking about with avoiding the use of the word family sometimes, or asking the question about, who do you call if you have a good day? Who do you call if a bad day? Who calls you? You can learn a lot of information. Look to other members of the teams with whom you work. If there is, for example, a case manager that goes to the home and sees a birthday card sitting on the counter, the individual might be saying to you, I don't have any family that I want to involve, and yet grandma sent a birthday card. So there might be openings there. So really work as your team to help you find clues about who the who could be that you reach out to. And then talking with the individual about, what might it be like to involve your loved one in treatment? What are some of your hesitations? And we want to validate and normalize whatever those hesitations are. And what are some of the potential benefits? And then really allow them to be in the driver's seat as long, I think it's healthy to have ongoing conversations. If they say, I don't think it's worth the risk of inviting my aunt to session at this point. And then asking them, are you okay if we revisit this in a month after we've done some other work? And then if they are agreeable and have identified loved ones, really working with those loved ones to provide them with information, to be a resource for them and to be a support for them. So, even though we have a quote unquote word I hate identified patient, it really is the whole system that we need to be addressing and supporting. And then, the fourth layer would really be working as a team with whatever organization you're with to coordinate care, to make sure you're all having the ongoing discussions so that, you're not aware that mom and dad are going through a divorce and somebody else on your team has this awareness. And, really taking that team approach can be very, very useful because we know individuals and systems share different pieces of information with different folks. So as long as they know that you take a team approach, it can be very useful. Obviously, just the disclaimer, it's safety first. So we don't want to invite individuals to sessions together until we do our due diligence to make sure that there's no orders of protection, talking about history of domestic violence, talking with them and really using our clinical acumen to assess, how does your family argue? Does it happen a lot? Does it ever escalate from yelling into pushing and shoving? And then really listening in. If you call to invite a family member and you hear a lot of hostility or critical words being used, that maybe it's not the best time to bring them together all at once, but are there other options? Can you work with dyads, different dyads or triads where you're still involving everybody who is interested, but you're not bringing people into an unsafe situation? And so it might take a little bit of navigating and finessing to do. Obviously, providing support to the system, ensuring they understand they have a role. I remember a few years ago, a very savvy mom, she was a physician herself, said, when the team, invited me to participate in this care, I thought it was just sort of a pleasantry, like, oh, we hope you'll participate. She goes, I didn't realize that I actually had a significant role to play. And there were, steps and things that I could follow and other things that I could be doing. So helping them understand that they have a role and that role will fluctuate over time. So there are going to be times when you may need to step in a bit more when somebody has a higher level of need, and helping them through their anxiety of being able to step back out and allow that individual some more independence and autonomy. And so really just thinking about, how you can start or continue to engage loved ones, even those who are over-involved or under-involved or anywhere on that continuum. What are some considerations? So that was primarily what I had to cover. My contact information is included here, so you can feel free to reach out anytime if you want to talk family or loved ones. I'm always happy to receive emails and set up times to call.